Good afternoon, everyone. I want to welcome you to our Tuesday press briefing with updates on COVID-19. As of this morning, we've lost over 130 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. I just have some random comments today. I want to apologize for not being here on Thursday. Early on, the chairman and myself, on behalf of all elected officials, we let you know that we were going to endure this with you, and that's true. My youngest son was a senior in college. This was his last semester. He came home for spring break. He was notified not to come back to campus. About a week later, like millions of college students in the country, he was notified classes would be conducted remotely and that the semester, for all intents and purposes, on-campus activities were over. My wife and I had to drive to Memphis to clean out our son's dormitory. I understand this has happened millions of times in our country. But what I want you to understand is that I understand. And Mr. Fowler and the chairman and every other elected official understands. We have families. We are enduring the restrictions. And that brings me to my statements today. First, our city manager informed the city commission that she is formulating a plan to reopen the city. I get questions. When will the courthouse be open? When will the government center be open? When will water, gas, and light be open? Well, these are difficult undertakings. For what reason? Because, as I said some weeks ago, I thought that once there was some date on the calendar and we were all going to resume our normal lives. There wouldn't be any more face masks, wouldn't be any more social distancing, wouldn't be these hand washing machines all over the place. But we all know now that's not going to happen. There's going to be a period, possibly an extended period of transition. And in this period, when city buildings open up, we will continue to abide by, insist upon, and abide by certain restrictions. And again, those restrictions will be for the protection of ourselves and others. I have questions. The city manager advised us today that the city will not open either one of the pools that operate in the summer. That's the pool at the Boys and Girls Club. Three pools. The Boys and Girls Club operates the pool on Jefferson, and the Boys and Girls Club and the city jointly operate the pool at Thornton Gym, and finally at Carver. These pools will not be open this summer. There are questions. One of our youth baseball leagues is affiliated with Dixie Youth Baseball. I'm informed that Dixie Youth Baseball has been canceled for the 2020 season. The Sherwood League is affiliated with Dizzy Dean. I don't think a final decision has been made, and I continue to receive calls from parents and coaches affiliated with the Dizzy Dean League, wanting to know when they can begin practicing. Well, if Dizzy Dean authorizes the league to play this summer, again, the city is going to insist upon very unconventional requirements if we have youth baseball. In other cities, Parents are being asked to take turns attending games. Some games, youth baseball games, are being streamed on Facebook so family members can stay home and watch the game. Some family members are asked to observe the game from their cars. I don't know if we will have a baseball season, but if we do, it will be much unlike anything we've ever known. There are issues of when schools will resume. I know my oldest son teaches high school in Worth County. A disadvantage rural school systems have is that many of their students do not have access to internet. They are unable to provide distance learning. And in these rural communities, we know from test scores that these students are behind those in other areas of the state. Consequently, there is a rush to return to schools in these rural areas because these students are being left behind more so than any others. There was an article in the paper today. I would commend it to each of you. Gentleman Andy Miller, he writes on health in Georgia. He was one of the authors about the emotional and psychological impact this pandemic is having upon Americans, certainly those who have lost their jobs. But what we need to understand, we're talking about children and teenagers. They have been taken out of school. It came to me the first week that we imposed the shelter in place. We were requiring teenagers to stay at home, but they couldn't go to the theater, they couldn't go to the mall, they couldn't go to parks to play with their friends, spend time. This is an issue that we as a society will have to address in the coming months. The emotional and psychological impact this pandemic has had upon us. Lastly, I received a letter on Friday. I didn't get it because I was out of town, from a friend of mine, and he expressed some frustration with these press conferences. Basically, this gentleman is saying, you're repeating the same thing over and over. We get it. What I want from you and the chairman is to see some leadership. I'm going all about town. I go to grocery stores. I see a whole family shopping together. I see people not maintaining social distance. I go to a drive-through. The waiters may have on face masks. The servers may have on gloves. Well, what I would like to say to my friend, and I appreciate you taking the time to write this letter to me, is that people need to understand local elected officials in the state of Georgia are constrained from taking any action which is inconsistent with the governor's executive order. That includes requiring citizens to wear face coverings. While I don't agree with that, I want to emphasize local elected officials cannot take any action which includes requiring citizens to wear face coverings. That is inconsistent with the governor's executive order. We can, however, encourage you to do so. The county commission has enacted a resolution encouraging all citizens of Albany and Dougherty County to wear face masks when in public. I anticipate the City Commission is going to adopt the same resolution next week. We are doing all we can do, I say this to my friend, by encouraging our citizens to wear face masks while in public, and also doing that ourselves. There are some ongoing discussions with large retail stores. It's my understanding from the city manager that some representatives of these stores have expressed some relief that their employees cannot require the public to wear face masks. And we all have seen from various areas of the country altercations between employees and customers regarding wearing face masks. I think it is absolutely irresponsible and ridiculous when people will go in a public place under the present circumstances and refuse to wear a face mask or face covering. Also, some representatives of stores have asked that citizens be encouraged not to shop in family groups. We have made that request before, and we're making it here today. My friend asked for some specifications as to what is required. I believe it's on the city website, and I'll make sure this afternoon. We have what they call an infograph. It's showing what is required. Now, I want to say this. It's my understanding that the only people in a restaurant who have to wear gloves are those who are preparing food. That does not prevent everybody from wearing gloves. But, of course, those in restaurants are required to wear PPE. My friend has asked that the public be advised, again, the proper way to wear PPE. You should cover your nose completely, your mouth completely, so the mask should be on the bridge of your nose and under your chin. Finally, my friend asked me, who is enforcing compliance with the governor's executive order? The task force has a conference call every Monday, Wednesday, and Friday. The sheriff's department has been performing literally hundreds of what they call compliance checks every 48-hour period. So has the Albany Police Department, but not nearly as many as the sheriff's department. Now, it's come to light, and I have received calls from people in the community complaining when I tell them compliance checks are being conducted. Well, they say, well, if the sheriff drives up in the brown car with Dougherty County Sheriff on the side, don't you think the people in the restaurant have time to put on gloves and masks? Maybe that's true. But we're going to hear today from Mr. Davis from Environmental Health, because they will be resuming that responsibility. And he will have more information than anyone else as to what is required and how these compliance checks will be performed. Let me say, I'm sorry if I sound negative today, because I know I'm speaking to a small minority of the community who are complaining, not complying, and are basically indifferent. I want to say thank you to the vast majority of our citizens who are working together to weather this storm. Thank you.
Thank you, Mr. Mayor, for your comments today. Now we'll hear from Dougherty County Commission Chair, Mr. Christopher Cohelis.
Good afternoon. Thank you, Chief. Thank you, Mayor. I get a lot of questions about my mask and whether or not I should wear it or shouldn't wear it when I come up here to the podium. And here's my position on that. I take it off when I come to the podium because I'm not within 6 feet of anyone else. And then I get comments with, other people are still wearing their mask while they're speaking, and that's their personal choice. But I'm not within 6 feet of someone. And I do this so that I can communicate more clearly the message that I need to communicate to the citizens. When I go out in public, when I go to a restaurant, when I go to a grocery store, I go to a shop, I go to a convenience store, I wear a mask. We are going to continue to evolve into this world. And we have many, many different questions, many, many different rules, many different recommendations on how this world is going to look for us on a forward-moving basis. The reality is that 7 days a week, 24 hours a day, wearing a mask or walking around in surgical scrubs is not, it's not realistic for citizens. our recommendations to wear masks are tailored to what the CDC has said and to what we actually know prevents the spread of the virus. When you are going to a grocery store, when you are going to a convenience store, when you're in situations where it is difficult to socially distance, then it is recommended to wear a mask. And that's precisely the reason why we at the County Commission and jointly with the mayor, and I anticipate that the City Commission will as well, we have passed a resolution recommending to all of our citizens that when you do go into public, which is your own choice, it is a personal choice, when you choose to do that, that we encourage all citizens to wear a mask in those instances. Ultimately, it's a personal choice. All of our lives, each day, every day, what you do, whether you decide to get out of bed or not, is a personal choice. We are merely giving information so that people can make the best choices possible. We know, as a matter of fact, that masks assist in preventing the spread of the virus or the receipt of the virus. And so we know that to be true. That's why we went ahead and took action. We can't require everyone to take a mask, and frankly, I don't know if that would be effective. But I do know this. We have seen the virus slow down significantly in our community, and it's due in part not only to the actions that we've taken at the policy level, but to the actions that have been taken by the citizens, by listening to things about social distancing, about masking up. When you go to a grocery store, frankly, every single person that you should see in a grocery store should be wearing a mask. That's a good decision. Now, and the mayor spoke to this, we've received a lot of complaints about people that are going to the grocery store and they're carrying their entire family. Look, I understand that some families do or do not have access to childcare, and sometimes some of those decisions are going to have to be made. But if you do, please think about these things. Children like to touch things. They like to put things to their mouth. They don't wash their hands perhaps as often as adults do. Think about making sure that they're masked up if that is absolutely necessary. But we encourage you, please, nominate one person from your family to do the grocery shopping. Take the time to make a list. Take the time to think about the different things that you need. Consider for a moment whether or not you can actually achieve these purchases by ordering them online. There are many delivery services also in the community. I know that many of our elderly citizens are making sure that they're taking advantage of these opportunities, or in fact, just doing the curbside pickup with the grocery stores. That eliminates, if we're more mindful and we're more disciplined, then we can eliminate the need for those interactions where you have to wear a mask. We have passed this resolution. I anticipate that the city will as well. It is a joint recommendation, as the mayor said, and I agree. We can't legislate anything above and beyond what the governor has already ordered, because that applies to the entire state. What we have said is we know that this works. We're encouraging every citizen to take this step. We have literally worked to procure thousands upon thousands of masks that are also available at the National Guard site. When you decide to go and get tested at the National Guard site that is behind the Civic Center, you can also receive a free mask. So if you don't have access to a mask, or you don't have access to a bandana, or you don't have access to those things, and you also wish to get tested, which is actually a good thing for us and for our community as we continue to move forward with this process in establishing where we're going. And I want to talk about that for a second. We have, and I have here on the screen a chart for the past 13 days. We are continuing to see the total number of positive cases flatten and lower. We're continuing to see the number of deaths go down. We know this from a variety of factors. I talked to the coroner, I talked to our EMS director, I talked to our hospital folks, we talked to our healthcare providers, the Department of Public Health, and we're seeing this across the board, which is a very, very good thing. And we have practices in place that will prevent a huge spread of the virus in a short amount of time, which is what we had to deal with on the very front end of this. But I also want to be very realistic with people too. We are starting to relax some of the rules. When I say we, the governor has made decisions about how we're going to start re-entering the world, the business world, and we have many people that are losing everything economically. They're losing their jobs, they're losing their livelihoods. And so this is a very difficult and complex time. And as we move forward, some of these numbers are going to go back up again. And that's part of the reality, and I think we have to be honest about that. And what we have to do is continue to manage it below the chaotic levels that we had at the very beginning, and which is the reason why we had to dig so hard, so fast, and so furiously, was to overcome that initial outbreak that was so bad and infected so many people, and frankly has caused more than 130 people to die. We still have 32 people in Phoebe that are on a respirator. Some will live, some will die. That's a reality. But what we do know is this. The overall rate of death has gone down drastically. The number of vulnerable citizens that we have prevented the spread from harming is remarkable. But it's still got too many of us too quickly. And we have to continue to think about the habits that we form and how we do certain things. And let me also say this. Some of us can get frustrated by seeing other folks that are perhaps not doing the things that they're supposed to be doing. And here's what I would say. Let's concentrate on ourselves. You can control yourself. You can control your actions. You can control your practices and your habits. And do the things that make you feel safe and that make you feel comfortable and that take charge of you and your family, rather than spending a bunch of time worrying about what other people are doing. And I'm not saying don't report in violations. What I'm saying is concentrate at this time on the practices, habits, and methods that will continue to keep you and your family safe, while also allowing you to move forward in this new world where we're starting to get back to business. And I cannot overemphasize enough, because I get many questions from businesses that are literally losing millions of dollars in their livelihood and the ability to employ people who need those jobs to put food on their table. And I would say this, we have to figure these things out and these new habits out as we move forward so that we can actually operate at some meaningful level as a community. Again, the trends that we are seeing are very positive, and I'm very thankful to our businesses and our citizens for what they've done. And we continue to talk about social distancing. One of the slides that they provided me with explains the math behind social distancing. And I think that this is a very good slide, because in a world where no one social distances, the average number of people you're going to come into contact with and that they're going to come into contact with is a huge number. But where you are social distancing effectively in a disciplined manner, this demonstrates how you slow the spread of the virus. So in this illustration right here, you have a 75% reduction. We don't live in a perfect world where no one's going to get infected. It's going to happen. It's going to continue to happen. And frankly, it has to continue to happen at some level, but we have to be able to manage it. And we also have got to wrap our minds around how we operate as a society. But what we don't want is the image here on day 30 where you have 406 people infected because no one was social distancing, no one was wearing a mask, no one was practicing safe sanitary practices. Those are the types of situations that we don't want to operate in, or we don't want to create. And we know what types of situations create those particular numbers. Again, I want to encourage everyone, please take part in the testing at the National Guard site. It's a free test. We have learned about so many people. There's so many citizens that have learned that they didn't have the virus and have gotten the relief from knowing that they didn't have the virus. And there are several folks that have also learned that they did have the virus and they had no idea. And as a result of that, they got a phone call The people that they had contact with got a phone call from contact tracers, and thus we were able to take steps to make sure that that small number of folks did not turn into the big number of folks that become infected. So again, we continue to do this, and I recognize a lot of this. I'm going to continue to say a lot of the same things, because these are the things that we know that have to be said, and it's important. And this is not the type of event where we're going to wake up one day, the sun's going to come up, and everyone's going to just walk outside and return to normal. Absent there being a vaccine of some sort, which I haven't heard of one yet, we're going to have to continue to move forward in sort of a measured approach where we reapproach different things in new ways. And I'm going to say this, my heart goes out to the businesses that are out there that have lost employees to death and that have lost their livelihoods. And we're going to have to continue to figure out these new habits so that we don't completely destroy our community's ability to earn a living, maintain pride, and maintain families. Thank you.
Thank you, Mr. Chairman, for your comments today. We will now hear an update from Phoebe Putney Memorial Hospital. The Chief Medical Officer is here today, Dr. Stephen Kitchen. He'll come forward for some remarks.
Thanks, Chief. And there are some notable developments that I would like to comment on today. As we've discussed at previous press conferences, we had been noticing a very favorable trend over the last several weeks in terms of the number of patients with confirmed COVID-19 infection at Phoebe Putney, as well as the number of new patients who are being admitted to the hospital with COVID-19 as well. And those trends are really best exhibited on the slide that shows the COVID-19 daily update. And basically, we had gone from a maximum of over 160 patients hospitalized at Phoebe Putney with COVID-19 down to a number that was less than 60, that was hovering at around 52. Similarly, we went from having a maximum of over 40 patients, new patients who were hospitalized in a single day. That number had fortunately gone down into the single digits and oftentimes was less than 5. What we have noticed, and I don't see the slide up there right now, but those numbers have jumped up the last couple of days, specifically on Sunday and Monday. And I want to comment on that and why. Those numbers don't necessarily reflect laboratory confirmed cases of COVID-19. We had been in a very fortunate position the last several weeks where we could do in-house testing for COVID-19, and those results would be provided to us in a matter of couple of hours. And so particularly for patients who were coming into the emergency room, we would have the ability to test them and know whether they were positive or negative for COVID-19, which is very important for several reasons. First of all, patients and families want to know. Secondly, knowing the status of their COVID-19 test allowed us to place them on the nursing unit of the hospital which was most appropriate, meaning we For patients who tested positive, we tended to cohort them on specific areas of the hospital. And similarly, for patients who tested negative, we put them on units of the hospital which were negative for COVID-19. We are limited in the amount of in-house testing that we can do by the number of testing kits, what we call specimen collection kits, that are provided to us by the vendor. And unfortunately, the number of testing kits that has been provided to us has steeply declined over the last several weeks. So we've reached a point over the weekend where we no longer had any testing kits and we were no longer able to do in-house testing. Well, what does that mean? Well, if we're not able to do the test in-house, we end up sending that test out to a large commercial lab called Quest. Quest can usually return those test results back in about 72 hours after they receive it. So what that really means is that rather than having a definitive answer whether a patient has tested positive or negative for COVID-19, we have now a large number of patients in the hospital who may have some signs and symptoms of COVID-19, but we really don't know what their status is. They are what we call a PUI, or a patient under investigation. So our numbers now, if you look at the number of hospitalized cases, it shows there are 82. However, about half of those are still patients whose test results are pending. So those may not be patients who are positive for COVID-19. What we have seen recently is well under half, well under 50% of patients who are coming into our emergency room are testing positive for COVID-19. So hopefully when we get those test results back, that number that's stated as 82 will be closer to the 42 which tested positive for COVID-19. For that reason, if you look at the COVID-19 census, you can see over the last couple of days, it's that peak has begun to go up. And again, that reflects the number of patients who still have an outstanding test at this point. And lastly, if you look at new patients hospitalized with COVID-19, you'll see over the last couple of days that number has jumped up as well. Like I said, we've been down in single digits for a while, but yesterday that number was 10. Well, those 10 people, those 10 patients are all patients for whom their test results are still unknown or undetermined at this time until we get the results of those tests back from Quest. So what I'm saying is that we may be seeing an uptick in the number of cases that are entering the hospital at this point. And as Chairman Cohilas has mentioned, it's almost inevitable. We are going to see some fluctuations. We do expect that those numbers will go up, but hopefully they will not be sustained and they will come back down. But again, our ability to be able to do rapid in-house testing helps tremendously in terms of knowing what the true status of that patient is, as well as allowing us to conserve the amount of what we call personal protective equipment that we have to use, because when we don't know the status of a patient, and particularly if they're having signs and symptoms, if they're what we call a PUI, we're going to treat them as positive until we have a definitive answer on their test result. The second development and one that I am very encouraged to share with you today, is that due to the large number of patients in our community who have been affected with COVID-19, and due to the large number of patients with COVID-19 that have been treated at Phoebe Putney, Phoebe has been selected as one of 8 hospitals in the state of Georgia to receive an investigational drug by the name of remdesivir for what is referred to as emergency use authorization by the Food and Drug Administration. So, really, what does this mean, and what is this all about? The normal process when a medication is being evaluated as being helpful or therapeutic against any type of disease condition, whether it be an infectious disease, a viral illness, a form of cancer, that drug will go under a series of tests or scrutiny that are called clinical trials. The normal process is that will occur usually over a couple of years, and certain patients will be selected again under a very strict protocol to receive this drug, to see whether it's effective and to make sure that it's safe. When we're under a global pandemic like COVID-19, which obviously has affected millions of people, and unfortunately hundreds of thousands have died, that process can occur more rapidly. It can be what we call expedited under what's called emergency use authorization. That means that the FDA has made a decision that this drug can be offered to patients who are affected with COVID-19. This doesn't occur without any evidence that the drug has been shown to be effective. In fact, in the limited trials that have been conducted to date, there are some very, very promising trends. And what do I mean by that? Well, like I say, in the limited studies that have been conducted in a very short period of time, bear in mind that this pandemic has only been with us for a few months, this drug, which is what we call an antiviral medication, which it has already been proven to be effective against certain types of viruses. Patients with COVID-19 who have received this drug called remdesivir have shown 2 things. Generally, the course of their illness has not been as severe as patients who did not receive the drug. And secondly, the mortality rate in patients who receive this drug is lower than patients who did not receive the drug. That's why it's been chosen to be used under, like I say, these very, very special conditions called emergency use authorization. However, I want to emphasize that because all the studies have not been performed, we still do not know with any certainty whether it will be shown over the course of time to be effective and whether it will be shown to be safe. So any patients who are presented the option of receiving this drug will be thoroughly counseled, and there are several there are several clinical conditions that have to be monitored while they take this drug. Their kidney function and their liver function has to be tested before they're considered to be a candidate for the drug. And secondly, their liver and kidney function will be closely followed during the time that they take the medication, should they choose to do so. And that is done on a purely voluntary basis. But again, I want to emphasize that Phoebe has been selected as one of 8 hospitals in the state of Georgia where this medication will be made available to patients who choose to participate in the trial. So thank you for your time. And thanks again, Chief.
As always, thank you for your report, Dr. Kitchen. We will now hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz, and Dr. Ruiz has some guests with him today, and we'll receive your report now. Dr. Ruiz.
Thank you, Chief. I'd like to start today by telling a very short story. I consider myself a moderate fan of college football, and about 5 or 10 years ago I was watching a game on TV, and I was pulling for my team, and one of the members of my team had the football in his hand, and he was streaking down the field headed for the goal line, and nobody was in front of him, nobody was on either side of him, and very few people were in close proximity behind him. And he was getting closer and closer to the goal line, and there was absolutely no reason why he should not score a touchdown. However, when he was about 2 feet from the goal line, he spiked the ball. And the best I remember, someone on his team recovered the ball, but they did not score a touchdown. They had to settle for a field goal. So that's kind of a clumsy story, but I think the point is probably pretty clear. If you don't finish the job, you may not be successful in your endeavor. So when we consider what we're all about here in trying to deal with this pandemic, we're trying to save lives, we're trying to contain the virus. We're trying to do that until a variety of things that may happen, until a better treatment comes along, perhaps like the one that Dr. Kitchen was talking about, or until the vaccine is available, or until the virus may weaken, or whatever. That's our goal. That's the day we're looking for, and we are not there yet. This is much too early to spike the ball and celebrate a total victory. We're not there. So it's very important to remember this virus is still in the community, even though the numbers that we talk about indeed are trending in the right direction. The virus is not gone, and it could rear its ugly head again, especially when people congregate in manners that are just not safe and not wise. So it can never be said too much, I don't think, that we should keep our distance, even though we may gradually be getting back toward normal activity. Let's remember that staying 6 feet away from other people is very important. Frequent and thorough hand hygiene is very important and very effective in getting the virus off of our skin. Wearing masks is very important as well. Great cough and sneeze hygiene is important. Let's don't drop these things that have gotten us closer and closer toward our goal. We still need to fight and to live wisely. One of the things that we can do as far as living wisely is to get ourselves tested for COVID-19, especially if we're having symptoms or if we know that we've been in close proximity to someone with COVID-19. It's a good idea to get a test. And nowadays, you don't have to meet any criteria at all. You can just simply get a test if you're curious to know. It's easy to get a test. There are multiple locations where we can go to get a test. And I'm sorry for my technical ineptitude. Okay. So there are multiple places. One way to get tested is through public health. And currently, it's easy to schedule an appointment. The number on the screen, 229-352-6567. That will put you in touch with an operator who can discuss with you the available locations, and you can work with the operator to pick out a location that's close to you and a time that is convenient for you. Okay, so this screen shows the opportunities over the next 5 or 6 days in the Southwest Georgia Health District. In Decatur County, you can be tested there tomorrow and this coming Saturday. In Dougherty County, there are several options. We are testing Tuesday through Friday at the Health Department on South Slappy, and then we have another location this Saturday at the Robert Harvey Elementary School. Grady County has testing today, this Thursday, and Saturday. In Mitchell County, testing is offered today through Saturday, with the exception of this Thursday. Testing will be done in Pelham. And I'm saying testing, and technically that's not the right phrase. We're collecting specimens, and the specimens will be sent to reference laboratories for actual testing. So in Mitchell County, the collections will be done in Pelham, Georgia on Thursday, May the 21st. And I believe this is the first time we've done this in Pelham, and we're happy to go there to offer this service and to make it more accessible. In Turner County, at the Health Department on Friday, May 22nd, and this Sunday, May 24th. In Thomas County, there are several options today. Testing Thursday also. And then Friday, a new location in Thomasville across from the Wright Street Mini Market this Friday. And then some information that's not on the slide that I want to talk about is we will be performing collections for COVID testing on Monday, Memorial Day. In Thomasville, there will be 2 sites, and I believe one will be at the Mount Sinai Church on Short Broad Street, and another will be at the Cross Creek School. Both of those are in Thomasville, Georgia, on Monday coming up, the 25th, Memorial Day. If I said the wrong thing, I may have said Labor Day, but it's Memorial Day. And then also on Memorial Day in Lee County at the Health Department, collections will be conducted as well. And again, the way to do this is by calling 352-6567. If a person tests positive for COVID-19, we want to ask if you will please go ahead yourself and get in touch with those people who have been in close proximity to you. Let them know that they have been exposed and that they really do need to put themselves in quarantine status. And the way this works is we would want you to go back to the time that your symptoms started and then go back 48 more hours. Anyone that has been in close proximity to you during that period of time, they need to know that they've been exposed, and they need to practice self-quarantine for 14 days following the most recent date of exposure. So we'd ask you to do that as soon as possible. And then in public health, we're going to follow up also. We're going to call that person and talk to them as well. It may be that you know how to contact them quicker than we would, you see. And then when we call them, they won't be shocked or surprised. And then we will take a thorough history and determine who has been in contact and advise people accordingly. There's a new thing that I want to talk about. The Department of Public Health is promoting COVID-19 testing for all residents and staff members of nursing homes. This is a statewide initiative, and we are strongly promoting it here in Southwest Georgia. Now, this is for people who have not been tested. It's okay to get tested another time, but for people who have already been tested, who reside in a nursing home or work in a nursing home, this initiative is not so much aimed at you. We are aware that there are a number of people who reside in nursing homes and quite a number of people who work in nursing homes who have not yet been tested. And we want to offer this testing and promote it and support it. So, in particular, if you work at a nursing home, you will likely hear from your supervisor in the next few days, and you'll be urged to get tested. We're going to try to make it as simple as possible. A lot of this can be done on site at the facility, and there are, again, a number of collection sites all around the district where people can go and get tested. And I'd like to now introduce a couple of my colleagues to come up and share some information with you that's very important. First will be Vamela Lovett. Vamela is the county nurse manager here at the health department in Dougherty County. And then she will be followed by Mr. James Davis, who is the Dougherty County Director of Environmental Health Services. So I'll ask Vamela to come, and she'll be followed by James.
Thank you. I'm going to talk a few minutes about what we call the pop-up spots here in Dougherty County. As we continue to offer testing at our 1710 South Slappy Boulevard location, we are prepared to and are going into the community to provide testing at what are called pop-up specimen points of collection, which we refer to as spots. As I shared with you last week, we provided testing at 2117 South Madison Street at the New Jerusalem Pentecostal Church parking lot located in South Albany. This Saturday, May 23rd, we will provide testing in East Albany at the Robert Harvey Elementary School located at 1305 East 2nd Avenue. We will again provide services for those who drive through and those who walk up. The entire process only takes a few minutes. You can call the call center at 229-352-6567 to make an appointment. Anyone can be tested regardless of where they live. We're encouraging individuals to get tested because you can be positive and experience no symptoms. So the only way to know for sure is to get tested. As stated last week, we will continue to assess the needs of our community and provide additional testing in various locations as warranted. Thank you.
Good afternoon. I'm going to talk to you today about a general list of requirements for the restaurants, but first I'd like to thank the Sheriff's Department for looking out for environmental health during this period, because without them, we really would have been behind the eight ball. They even sent a team over to talk to us and get us up to speed with the governor's executive order as it relates to restaurants. But and I really wanted to send a shout out to them for doing that for us. Food service facilities with dine-in services can now have 10 patrons per 300 square feet, and this was increased from 6 per the previous order. Food service facilities must screen all workers for prior illnesses prior to entering the facility, and we're talking about screening them for fevers of 100.4 degrees Fahrenheit, cough, shortness of breath, difficulty breathing, fever, chills, muscle pain, sore throat, or new loss of smell or taste. Food service facilities are required to find out if workers exist signs of illnesses, to have them to either not report to work or to seek medical attention, and this is per the existing U.S. Food and Drug Administration food code. So workers who are sick should remain at home. And if a food service facility with a known or suspected COVID employee, this employee is required to follow the Center for Disease Control and Prevention guidelines to self-isolate for at least 10 days after symptoms onset, and in isolation after symptoms have improved and the worker has been fever-free or symptom-free for 3 consecutive days without medication before returning to work. Food service facility workers must wear face coverings at all times, and they may also wear a face shield, which is the plastic covering in addition to the face covering, but they must have the face covering on. Face coverings and face shields must be either replaced or cleaned daily. As far as the gloves are concerned, we've gotten a lot of questions about the gloves, and there's really nothing in the executive order that singles out gloves in a restaurant, which means the Department of Health rules towards gloves or what will apply. And basically the rule is no bare hand contact with ready-to-eat foods. And what I mean by that is a lot of times people are going to a restaurant and they see somebody making their pizza, they wash their hands and they start putting the cheese and the pepperoni on it with their bare hands, and then they run out and start calling my office. Well, it's not ready to eat at that point. So once it goes into that oven is 600 plus degrees. Once it comes out, at that point it's ready to eat. And therefore, at that point, there should be no handling that food with bare hands. So again, the rule is no bare hand contact with ready-to-eat food. The person at the drive-through window does not have to have gloves on. They can do so if they require it, or if that's their restaurant policy, but it's not a requirement. Salad bars and buffets are no longer allowed. So, however, cafeteria-style buffets, where you have a tray, the servers actually put the food onto your tray. Those are okay, but no buffets as we know it. There would be no buffets. Food service facility, dining room, playgrounds, those are closed until further word. And in between diners, if you have sit-in diners, in between diners, the food service facility workers will clean and sanitize table condiments. And what I mean by table condiments, they have to be the self-serve packages, no more bottled ketchup or anything like that on the table. Has to be in a single-serve package. They have to clean digital ordering devices, check presenters or the trays that your tab come on. Commonly touched table areas, prepackaged table condiments need to be removed and discarded between each diner. Only rolled silverware or prepackaged plasticware is to be used. No table presets are allowed. There will be no self-service drinks, like McDonald's has the self-service area. Those are no longer allowed. Condiments, utensils that are self-service or table stations where you can go and pick out your own plasticware. Those have to actually now be provided by the food service workers or the facilities workers to the patrons. Disposable paper menus are suggested, but if you use your plastic reusable menus, they have to be re-cleaned or re-sanitized after each use, each patron. Seating arrangement should ensure at least 6 foot of separation from seating. Sometimes booths may actually require batteries to accommodate this. And facilities will limit party size to no more than 10. Facilities will place signs on the entrances stating no one with fever or symptoms of COVID are permitted. And hand sanitizer must be made available to patrons entering the facility and to workers throughout the day or throughout their shift. Patrons are not allowed to congregate in the waiting areas, and the facility shall design a way to keep patrons separated including form markings, or use outdoor distancing, or you can actually have them wait in their car, and when their turns, I know a lot of the restaurants use the little beeper thing when it's your turn. The light goes off and it vibrates to let you know. They are allowed to use those also. In response to the question that the citizen asked the mayor about, when the sheriff's car pulls up, do you think they have time to go in and clean up before they get out and get into before they get out and enter the store? And the answer to that is yes. I mean, an inspection is basically only a snapshot in time. It can't account for what happened 15 minutes before I got there. And once I pull out in that parking lot, I don't know what they're doing again. I can only educate them on what the right thing is, and I can hope and pray that they do the right thing, but in all honesty, no, I can't make them do the right thing. Thank you.
Thank you, Dr. Ruiz, for having your team here. Mr. Davis, Ms. Levitt, thank you for your reports today. We will now receive a report from the Dougherty County School System. The school superintendent, Mr. Kenneth Dyer, is here. We ask Mr. Dyer to come forward, please.
Thank you, Chief. Good afternoon. A few updates from the Dougherty County School System. Virtual graduation ceremonies will be held for our 3 high schools in Dougherty County this Saturday, May 23rd. Westovers will be posted on our social media and our website and our YouTube channel at 9, Monroe at 12, Dougherty at 3. We are planning for a traditional in-person graduation ceremony sometime this summer if public health officials deem it safe to have mass gatherings. We'll be working with our partners in public health to determine what protocols need to take place in order to ensure a safe event if, in fact, we're able to have a traditional in-person graduation. Senior Spirit Week began this week, Monday, the 18th. This week consists of a variety of virtual activities for our seniors based on the theme of the day. Also, high schools are going to the schools this week to clean out their lockers, turn in computing devices and hotspots, and take care of end-of-the-year transactions. Dougherty started yesterday and will go through Wednesday. Monroe started yesterday and will go through this Thursday. Westover will start tomorrow and go through next Thursday. The schools have already contacted families to let them know about the details associated with what grade levels go on what days. However, if you have not gotten a call, please check our social media pages for the Dougherty County School System. That information is available on those pages. Please note that the schools will be adhering to CDC and public health guidelines. Each student entering the building must have a mask or a face covering. Temperatures will be taken upon entering the building, and social distancing requirements will be adhered to while they're on school property. Next, the meal service delivery will continue through the summer with our traditional summer feeding program. Please note that this week, on Friday, we will deliver meals for Friday, Saturday, Sunday, and Monday. We will not make deliveries on Monday, so we will not have meals available for Tuesday. We will recommence on Wednesday. It's important to note that since we began meal service delivery on March 16th through last Friday, May 15th, the Dougherty County School System food service employees and transportation employees have delivered 526,000 meals to youth in the community. We appreciate them for that. Coming soon, you'll see details about our virtual summer school for elementary, middle, and high school students. In addition, we're planning for fall, whether we are doing that in person or virtually. We have plans in place for both, and we'll be sharing those details in the coming days. Thank you, and I'll be available for any questions after the conference.
Thank you, Superintendent, for your remarks. We will now hear updates from the Dougherty County Coroner, Mr. Michael Fowler.
Good afternoon. We're going to go over the update from last Tuesday when we gave our last presentation. As of today, the 19th, April the 19th, May the 19th, we have 137 positive deaths in Dougherty County, residents in Dougherty County. On the north side of Albany, 31721, we have 17 deaths. 31707, we have 29 deaths. On East Albany, we have 29 deaths. In South Albany, it's gone up to 62 deaths in 31701. Females, we have a total of 77 females that's deceased. Males, we have a total of 60, at 44%. Based on race, we have 1 Latino, we have 30 whites, and we have 106 blacks at 77%. Based on gender and race, we have 1 male Latino, we have 22 white females, that's 15%. We have 8 white males at 6%. We have 51 black males at 38%. We have 55 black females at 40%. Based on age, again, we still have 1 that's over the age of 100. We have 11 in the age of 90s. We have 27 in the age of 80s. We have 39 in the age of 70. We have 40 in the age of 60. We have 7 in the age of 50. We have 8 in the age of 40. We have 3 in the age of 30. We have 1 in the age of 20. The average age now is 72. The oldest one is 104 years old. The youngest is 26 years old. Location of death, we have 109 that died within the hospital, one of the hospitals. We have 22 that died at the nursing home, and 6 died at the residence. Nursing home residents, we have a total of 38 and 99 outside of the nursing home. Number of deaths per week, the first week, April the 15th, we had 10. The second week, we had 16. The third week of March the 29th, we had 28. April the 5th, we had a total of 26. The 5th week, we have April the 12th, we had 25. Then it dropped down April the 19th to 7. Went back up the 7th week to a 13. The 8th week, it dropped all the way down to 3 deaths that week. Last week, we went up to 7. And this week so far, we have 3. So the first 5 weeks, you see the numbers are real high. And in the last 5 weeks, the numbers have dropped. The death rate has tremendously dropped down. And I think it's based on we practicing social distancing, washing our hands, and doing what is right. I want you to keep doing that. You got to keep praying, giving God the glory, keep practicing social distancing. And I think that eventually this thing is going to settle down. But the way the death rate is going down, and that's what we want to see. And we'll encourage everyone, like I said, get tested, and also wear your mask. Definitely, please wear your mask. They're going to be very important to wearing your mask. Again, thank you, Chief.
Thank you, Mr. Coroner, for your comments today. We will pause for a moment to acknowledge any questions from the media. Okay. If there are no questions, we will again remind you that the Emergency Operations Center is open 7 days a week. If you missed anything today or like access the resources, please call the EOC from between 8 and 5, Monday through Sunday, 7 days a week at 229-302-1900. That's 302-1900, and we will certainly route you in the right direction for those resource requests. And again, we end today by asking you to mask up Albany, mask up Dougherty County. We will see you again on Thursday at 1 p.m. for our bi-weekly press conference. That ends our conference for today. Thank you.